about, sadly, when you have a patient with cancer, right, penile cancer, and you have to take the penis off, and that's dramatic,
Yeah.
and that's tragic. However, let me say this though: this is over the last few years, a couple of medical groups they perform a penis transplant. Now, what happened was whatever the cause was, cancer, trauma, whatever. These doctors said, "Hey, let's try to put a penis on." I mean, remember years ago, the lady had her face eaten off with a chimpanzee, and they put a face back on her. Well, they had to learn how to put the very small arteries and nerves together. So these plastic surgeons and other surgeons learned how to do that. So the Department of Urology learned that too, probably from them. I believe that's the case. So they said, "Hey, let's do a penis transplant." So they put someone else's penis. It's like putting a kidney in another person, right? Kidney transplant. This is a penis transplant. So they took this penis and put it on the person's body there, attached it, and within 2 days they had an erection. Okay, in other words, it was flowing. The blood was flowing. It was going into the corpus cavernosum. They were getting erections and so forth. So anyway, for those who don't have a penis, if they had a tragedy of some sort, and they've done this twice, at least so far, I think that's awesome medicine to do a penis transplant. I think that's
There's
awesome.
some future science out there. I mean, we may even get to a point of organ donation. You never know.
That is, I mean, I think that's awesome to provide a penis to somebody. Now, it would be nice. I mean, if someone, let's say, lost their penis and they had the ability or the option to select the penis they wanted, it's like, Mr. John, what kind of penis would you like today? Okay, we have this 5-inch model here. They're gonna pick the 5-inch model. But they might pick a model if it's offered to them. Maybe they say, give me that 8-inch guy over here, the 7-inch guy over here. This penis. Give me that 7-inch.
See that happening. Back in my younger days, I worked for the American Red Cross, so I was the guy that came in. When somebody donated tissue, I was the one that took heart for valves, the kidneys, the skin, bone. I did all that in my earlier part of my career. Could you imagine also taking the penis?
I say take it all. I mean, I say, if you need fingers, arms, legs, I don't care. Maybe they could just chop your head off and put it on a whole body, make it simple. You get the whole thing in one package, whatever. That's not coming soon anyway. But transplant technology has gone a long way. Obviously, we do it. We've actually transplanted arms. I mean, hands. The problem is psychologically. This one case where this patient had his hand, someone else's hand, put on a transplant, right? So his hand is not his, someone else's, but they can't live with it. They can't psychologically connect to it. And this particular person, he said, "Look, I'm stopped taking my immunosuppressive drugs," and he knew it was going to happen. So it died. The hand actually died because the body's immune system started attacking it. Because he says, "I'd rather not have a hand." But when it comes to the penis, I'll deal with the problems. I don't care.
There's motivation
that's
there. There's motivation, yeah.
Exactly. Anything else you might want to talk about today?
I can tell you that, as a urologist and getting into male enhancement, I've had a chance to look at several different procedures I've done. I've looked at the thing with fat transfer, I've done the implants, I've done fillers and all this other kind of stuff. But I've never come across a procedure where I realized that the doctors actually want this procedure. So what I've noticed here with what we offer is the actual doctors that offer this, they want this procedure themselves, and so did I.
That's funny that you say that, because
Yeah.
when I have doctors come in for training, I don't tell them to do the procedure, right? Excuse me. I don't tell them to do the procedure. I just train them, right? I say, "Look, this is how we do it. This is how you inject it. Here's the technique." And usually by day 3 or so, usually we train for a week. By day 3, they'll come up to me and say, "Hey, can you get me in the schedule?" Okay, because they're believers. Okay, seeing is believing. All right, bottom line. So I would say that 95% of the doctors I've trained will tell me, "Hey, I want to get on your schedule. Let's get going. I want to do this myself." And that's good, because it's not like you're saying that, "Hey, this is great." You got skin in the game now. Okay, you did it because you're a believer in it and so forth. Plus, I'm sure for you, for Dr. Fussell and other doctors and patients, look, we're men. We know how we think. We know what we want. I mean, I talk to people from all over the world. They call me and say, "Hey, I don't think I'm satisfying my wife." I get calls from India and other places. The bottom line is, look, we all kind of want to do it. And we can benefit from that. And my message to my audience is this: if it's something you feel that'll benefit you, even psychologically too. Now, it's not that's a pure physical thing, okay? It helps us. It makes us feel better. We feel like we're more of a man. I mean, you know what I'm saying? I mean, I hate to say that. Not that we don't feel we're men, but it makes us feel better. It gives us confidence. It gives us that hope. And when we go into the bedroom, right, we have that confidence, right? Oh, greater confidence and so forth. And I think that it's across the board for everybody. I mean, the psychological impact is incredible.
And I can say this: if you're sitting in front of a physician that's offering male enhancement, if they're not willing to do the procedure that they're offering you on themselves, you might want to think twice. This procedure, I can honestly say I've had it done. I went to my wife and I said, look, I want to be able to tell my patients that, hey, this is safe. I believe in it because I've had it done. She was like, well, you don't need it. You're fine. And I'm happy where we are. But I'm like, it makes a big difference when I sit down in front of a guy and I'm telling him about this is what I offer. Now, the thing is that the first time I did it, it was for you guys. If I go back and do it again, it's for myself. So
I want to make a point about the ladies. Now, the ladies will say to their man, everything's great. They don't want to upset them, really, right? Hit their ego pretty hard, saying, hey, honey, you're kind of small and shriveled up there. You want to do something about it.
Yeah.
We don't have these conversations. Like, you would never say to your wife, hey, your vagina's a little loose there. Why don't you tighten it up? We don't have those conversations. However, I'll tell you a quick story. We had a patient come in, and he said, I told my wife I wanted to do this. So I said, how'd it work out, John? He says, well, she said, I was good. I didn't need to have this done. But he said, look, I really want to do it for me. I really want to do it for me. He says, well, it's kind of expensive. He says, well, all right, I'll sacrifice. I'll do it. I'll put the money aside. Then there was almost like a fist fight between the two. So I said, John, that's pretty bad. That's sad. But anyway, let's get it done. Let's get your filler done today, and so forth. So I said, I guess I'm never going to see you again. Maybe in the future, who knows? But anyway, 3 months later, here he is back in my office. So I said, how is John back in my office? Either maybe his wife passed away or they're divorced, because there's no way his wife's going to let him do it, right? We already know they almost had a fist fight. So he said to me, Dr. Loria, let me tell you what happened this morning. My wife woke me up early. She made me breakfast. She said, hey, we got to catch that plane to see Dr. Loria today. That's exactly what she did. Why? Because she recognized what Girth did not only to him, the husband, how his confidence was better. She likes that when she sees that in her man. But in the bedroom there, she also benefited, right? She had more vaginal stimulation that she really never had, from what he said. And that's why now she's on board. Okay, so for you ladies watching this is important, is that let your man do his thing, okay? Because even if, let's say, you don't want it per se, let him do it because he's going to feel better about it, right? Confidence, self-esteem, and all these types of things. And that's real. I mean, that is
very, very real. I can tell you as a urologist, I've sat there many times with guys sitting in front of me, and I'm having to convince them that they're within the normal spectrum of size. And they're like, no, doc, I'm too small. Or if their ego has been crushed by a female saying, hey, you're too small for some reason. And that's damaging.
That's the kiss of death.
It's like the kiss of death.
Yeah.
And it can be used like a sword. If I want to hurt you, I'll tell you something like that.
And you never forget it either. I mean, these guys, it's just like a wound that they carry. I'll tell you that when the patients get treated, hey, look, the bottom line is they want to be the biggest tool in the tool shed, okay?
Yeah.
Or at least significantly increased in size. It is a different world when you go from, let's say, a 5-inch length and 4 3/4 girth to perhaps longer and erect, let's say, and flaccid, maybe even to 6, perhaps more if you can get there, but the girth of being 7, you're in a different world, okay? It's totally a different world. When you're able to have intercourse with your spouse and stimulate her with your tool, instead of like some patients say, I got to use, artificial things, like dildos, whatever it may be, toys, sex toys. You want to be the sex toy, okay? Bottom line, okay? Because that makes you feel like, hey, I'm, you just feel phenomenal, right?
Yeah, it's quite a thing when you walk into a sex shop and you realize that none of the toys on the shelf match my size.
They just don't have that model there. That's a good point. You'll never see that model there.
No, you don't see
that.
that.
There's a reason for that.
You don't see that girth.
So yeah, that's real too. I mean, these they sell all sorts of things and so forth, but the men want to be the toy, okay? And what's really fulfilling for us as physicians, when we're able to provide a service, right? We're able to get that thickness and so forth. And some guys, if you look at the bottom of this cup, that's basically a 7.5 and so
Yeah,
forth. So
yeah,
that's not that's a. I mean, I know it looks like a lot. I don't want to spill my coffee here. It's very important, this
yeah.
coffee. But if you look, I mean, that's a substantial increase in size, in girth. You know what I'm saying? And that will hit the walls of the vaginal canal without a
And
question.
usually we recommend around about 6.5. So take that dollar bill and roll it up. That's 6 inches, standard size length of any bill, dollar bill, $20 bill, and you roll it up so you can actually get a visual of what 6 inches looks like, and say, oh, another half inch. That's where you start kind of crossing over to what can be accommodated.
Real stimulation. That's what we're talking about here. Now, I do extend the parameters on the recommendation. So I'll tell patients I recommend 6.5 to 7.5. If you stay within that range, it's pretty good because I've done many of these and I interview a lot of patients and I say, hey, how did it feel, John? You went from 5 inches to 5 3/4. Oh, it's good, right? But there's still room in there. So then we go to 6.5 and they say, wow, that's significant. Now, if they still say there's a little play in the vaginal space, I let them make the call. Do you want to do another procedure? Maybe go to 7. Maybe 7 is perfect for you. And then they figure this out themselves. Okay, that's what every patient has to do individually and so forth.
And I've had those conversations with females, would you rather see girth or length? And most women say, hey, I definitely, girth is where it's at because they want to actually feel that vaginal canal and they can feel all sides. So is it better to have a long, thin penis or a short, fat penis? The short, fat penis is actually going to win out. That's not what most guys think because they want it to be longer. Now, we can make you longer, but the thing is that girth is filling. Play on words.
Yeah. I tell patients, I don't care if you're 10 miles long. If you don't have girth, you're not going to stimulate. The
Yeah.
vaginal canal only goes so far. Girth is king. That's the way I put it. Girth is king. Now, everyone, I think the pornography industry has poisoned the minds of men where, you have these long penises there and the women are having a great time, but they don't tell you this. After everything's over and the acting is done, the women go back to their 6-inch long boyfriends that are thicker. Okay? Because thickness stimulates, not length. Okay? So visually, we might have that image that, wow, that 9-inch looks great, that 9-inch penis, 10-inch penis. But those women feel pain. Most of them feel pain, okay, because you're hitting the cervix, right? It's only so far you go in, and that's it, okay? It's like getting punched in the face. In fact, when I used to do group consultations, right? So I would ask men. I said, okay, let's say we have 30 people on the line, 40 people on the line, and we'd have a group consultation, so I'd speak to everyone at once. But one time I said to the crowd there, the people listening, I said, if you have a 7-inch penis, let me know, okay? And if you have a 9-inch, let me know. I want to ask you a question. So as I'm going through all the patients' questions one by one guy came up. He says, yeah, I have a 7-inch long penis. I said, okay, what does your wife say when you're having intercourse? She says it feels like it's poking her, it feels like it's poking her. That doesn't sound too good, you know what I'm saying? So that doesn't sound like it's pleasing, right, or stimulating in a positive way. Now, I went through a few other patients because we go through questions. Each one has 3 questions to ask and so forth. So I'm going down a list, and one guy says, hey, I have a 9-inch long penis. I said, what does your wife say when you're having intercourse? She says, it feels like it's stabbing her, okay? You see the point, okay? If we get into the facts of the matter and we're honest, okay, even though length looks good, kind of, and the women during intercourse in the pornography thing, they're really acting. I mean, let's be honest here. I can interview a lot of these people, and hopefully I can get them to confess to that. They're really acting. Bottom line is length is not where it's at. Of course, a 3-inch penis is a problem. Let me just clarify. The micro penis could be an issue, okay? So we're assuming that your normal length, 5 to 6 in erect length and so forth. If you have that girth, you put that 7-inch girth on, the world changes. Bottom line.
Without a doubt. I mean, the thing is that as a surgeon, where I'm spending most of my time below the belt line, I'm the pelvic surgeon. I don't spend as much time working in the vaginal canal as a gynecologist. But as a urologist, we still have to know what's going on because the bladder sits right above it, things of that sort, and there are other things that we have to be concerned about. But, you realize that, hey, just studying that anatomy, that the nerves are in the walls of the vagina. And basically, it's and after a female has a hysterectomy, then the vagina becomes almost like a blind sock. So everything's been closed off because the cervix, everything's been removed, the uterus is gone. Can you actually feel the sock? And that's what really comes. Can you actually touch all the walls to get full stimulation? So are you going to put a pencil in the sock? Or are you going to put something full size in the sock?
Bottom line, anatomy and size and so.
Yeah.
But that's the bottom line. Well, I want to thank everyone for listening to our conversation. And Dr. Fussell will be back. We'll talk about more things. If you have any topics you might want to talk about, you can certainly submit that or let us know and so forth. We don't mind talking about anything you wish. But I will say this. Consider getting the girth treatment done, okay? Length as well and so forth, because it really is a life changer, okay? It really is a life changer. Also, we should mention that, we have a fair amount of testimonials. You could, see the testimonials. I even have sometimes I can get patients to talk to you on the phone too. That's kind of nice to have that, okay?
Yeah.
And so forth. But if you feel that you don't have that confidence, and that self-esteem is not too high, it's kind of low and so forth, and when you're in the bedroom situation and you don't have that confidence, seriously consider doing this. Just make the call. You can go on the website info, they'll give you my email, but the loriamedical.com website will have information. Dr. Fussell's website, what's your...
UroHard, that's URO, like urology, URO hard, HARD.com. So you can look me up there and understand I cover all bases. I can make you bigger, I can make you longer, and I can make you harder.
And that's really the bottom line. So lastly, regarding the economics of it, I know a lot of patients say, hey, I'd love to do that, but I don't have the funds and so forth. There's third-party people that could lend money and so forth, okay? So I tell the young guys usually that, hey, I want to get this nice Mustang car or whatever. Forget the car, okay? Get a bicycle, okay, and do this procedure because that outweighs the dividends that you'll ever get from anything else, okay? It's really kind of kid around that way, but, in regarding budgeting, I always tell patients, well, do the best you can. We offer promotions and all. We try to help our patients out and so forth. We have these finance plans and all that. So
yeah, lots of financing available. And I've had friends out there. I actually had a friend that bought a Rolex, and he spent quite a bit on that Rolex. And I said, well, you could have had your penis enhanced for less than that Rolex, and that's for life.
That's right. That's the point. That's the point. Okay. So anyway, we're going to conclude. Great conversation with Dr. Fussell. And we're going to be back again.
All righty. Thanks for having me. I appreciate it.